A very warm welcome to all the regional directors and our dear students of Certificate in Community Health program. I hope that you must have got information of today's teleconferencing session, and today we will be discussing one of the very important topic from your practical course, that is BNSL 043 Block 2 and Unit 6. This Unit 6 is about the common dental conditions, their management, prevention and control of oral infections, and you have to take care of the community patients at their grassroots level. So you be very attentive, because to discuss this topic today we have with us Dr. P.N. Mehra, who is the head of the department from Lady Harding Medical College, and he is the from the dental department, and Madam Mandira Mehra, who is also senior consultant in the dental department. So I welcome sir and madam for discussing this topic, and be very attentive to this session and clear in case you have any doubts. And before we start the session, I would like to give you one important information, that there might be any change in the pattern of question paper in the June term and examination. You remain prepared either for the objective type or the subjective type papers. If it will be subjective type, it will be of 3 hours duration, and if it is objective type, then it will be 2 hours duration, but the information will be announced on the website of IGNOU. So with that information, let me start by asking one important question, that what will be the gist of today's session in brief, and then you can start with the oral cavity and the dental conditions, various dental conditions. Sir, please.
Thank you, Dr. Rita ma'am, and welcome to all the dignitaries there, students there, the nodal officers regarding the certificate in community health who have enrolled to that. I think you've gone through the Unit 6 chapter on common dental diseases and conditions, how to screen them, how to manage them, and what is the importance of oral health, of dental tissues. So we will just consider in this talk of ours, both Dr. Mandira ma'am and me would be taking care about regarding common dental conditions and how to screen them, and of course how to prevent them also. That's more a prevention and promotion being the major issue in our talk here. So can we start, ma'am,
Yes,
if you
sir.
can give us a permission?
Yes, sir,
Okay,
please.
thank you. So, as we said that when we defined any systems approach to problem solving, like if you see in this slide of us, you have two systems which are being represented, one a watch system and other a human body system. Now, automatically the question comes to our mind, what is a system? A system normally is an interrelated or an interdependent parts arranged in a manner that produces a unified whole, meaning that every system has a defined output in mind. And to get that output, what it requires is certain interdependent and interrelated parts. Like in the watch system, you have the seconds hand, the minutes hand, and the hours hand. And these parts of it combine together to produce a defined output, which is the time, right? But it is not the time actually, it is the exact time which is produced for the watch. Because if the watch is not giving the exact time, then the defined objective of the watch is not being met. Similarly with the human body, you have various parts in that system, human system. It could be the CNS, as you all know, the CVS, the muscular system, the GI system, the oral system is a major part of it. And if by any chance if that person cannot open his mouth properly, or if he cannot chew his food, or if he cannot talk properly, or there is swelling there, or there is pain in the oral tissues or the dental tissues, then automatically the defined objective of the human body is not met 100%. And then the output will not be 100%, and that patient either would not be coming to his work, or be not in a proper frame of mind to do the defined objective from the work defined. So let us define what is health. We all know health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But one can't be healthy if one is not orally healthy. And oral health is very essential to general health and quality of care. Now, oral health is a state of being free from periodontal gum disease, tooth decay, tooth loss, mouth and facial pain, oral and throat cancer, oral infection in soles, and other diseases and disorders that limit an individual's capacity in whatever function the oral cavity there, whether it be biting, chewing, smiling, speaking, psychological well-being. And if we define oral health by the World Dental Federation's definition, then oral health is multifaceted and includes ability to speak, smile, smell, touch, and taste also. It also has chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain. That is more important. There should not be any pain when he does all these functions. And of course, without any discomfort and any disease that is there. So good oral health is more than just an absence of disease. Now, why is oral health important? Let's go into it. If you see this slide of ours, the first thing that comes to your mind, obvious is very obvious, right? And if you see the second slide, again, the first thing that comes to mind again is very obvious. It is the dental part, the oral part that you see, right? And if you go back and see this slide, the arm that is going around the male's shoulder is not the arm or the female. So we didn't notice that. So the appearance is the major issue here. We see whatever on the oral tissue, we concentrate our eyes directly, and our image catches immediately what is lacking in that oral tissue to happen. In the similarly, second slide, if you see, we saw the dental part, that there is some decay or black spot in the oral cavity of the man, and the teeth are blackish in color. But as if you see, the arm that is going around the shoulder of the human being or the male is basically having 6 fingers and not 5. And we have not identified that out. Similarly, if you go to this, okay, so I think that was appearance. So teeth are very important to appearance that you find. And they not only make a nice smile, but they also shape your face around. And if you see, the second important function of the oral cavity is chewing. Teeth are important to chew food properly. The chewing of food with your teeth is the first step in the digestion of food. If food is not chewed properly, it can cause problems with digestion. The third is speech, or as we say as talking. And teeth are important for speaking. If there are no teeth, then automatically the walls, that sound that comes out would be like an old man when he starts speaking with a bob bob thing there. So teeth are very important for speech also, what we understand. So teeth work with the lips and the cheeks and the tongue, and allowing us to pronounce words properly. So oral health, basically if you see that, is essential to quality of life. And oral health affects, as we know, biting, chewing, smiling, speaking, and psychological well-being. Oral pain, of course, can cause poor school performance in children, work loss in adults, difficult chewing, and poor nutrition. Of course, costly emergency department visits would be added on if you do not have care for the oral pain if it happens. Dental decay and tooth loss can lead to aesthetics and self-image issues, speech and language development problems, and costly restorations. So oral health is basically bidirectionally related to general health. It's related. So effects of one's everyday quality of life, if you see, the mouth is a gateway to the body, and all the bacteria or the disease enters the body through the oral cavity. The health of the mouth influences other aspects of overall health. Taking care of the mouth helps keep the rest of the body healthy. Studies show that oral health is linked to systemic diseases like cardiovascular and diabetes. An unhealthy mouth has been found more often in people with other types of chronic diseases like diabetes, heart disease, and rheumatoid arthritis. So let's see what are the burdens of the common dental disease and conditions. Now, the burden of oral disease conditions worldwide is very high, in spite of the fact that most of the diseases are non-communicable in nature and preventable with simple measures. If you see the WHO statistics for the world, it says around 60 to 90% of school children have dental cavities. 15 to 20% of middle-aged, roughly around 35 to 44 years age group of males, adults, suffer from severe periodontal or gum disease causing loss of tooth. and about 30% of people aged between 65 to 74 years have no natural teeth. So they cannot bite properly, they cannot chew properly. So all the functions of the teeth or the oral cavity has to be done by the stomach and the intestines. Oral cancer accounts for roughly around 30% of all cancers in India. And lastly, the prevalence of oral and maxillofacial injuries is roughly 16%, and most patients are in 21 to 30 years age group, with male to female prevalence of a ratio of around 2.2 is to 1. So what does it symbolize here? It tells us basically that all these diseases can be preventable. And why in our country is important? Because the demographics of our country favors a younger population. And if we want this population of ours between the age group of 20 to 40 years to be productive in the GDP for the country, I think we will have to see that these patients do not suffer from oral diseases. And as I said, these diseases are preventable in nature. And if we can follow them, and if we can make an awareness in the community and identify them at an early age, automatically these diseases will not hamper the production from that human being which is desired.
Sir, I would like to add here that as non-communicable diseases are on a rising trend, and our students, they are being also looking after the NCD's clinics, so there they are more focusing on diabetes, cardiovascular diseases, as well as the cancers. So now after learning this, they should be more careful that diabetic even can have oral problem, cardiovascular patient can have oral problem. So do not neglect oral health as well whenever you are looking after the NCD patients also.
Yeah. So it's very important actually in our country. If you see, the oral health is as related with systemic health, which Madam will tell you about it also. And it's vice versa. If you don't have good oral health, automatically your diabetes will not get controlled. And if your diabetes is not controlled, then automatically oral health also will be bad. So there's a very much relationship between systemic health and oral health. And we'll come to it. I think I would like now to request Dr. Mandara there. She should carry over and tell the importance about the oral health part to our fellow students there.
So good afternoon, dear students and all the dignitaries who are part of this program. We are here to give an insight on oral health because oral health is actually a mirror to our systemic health. It's an indicator of our systemic health. When we examine the mouth, we see the teeth, we see the oral tissues, and there are a few things which I would be discussing about. So we have to really keep ourselves alert and keep our eyes open to see for these things, because by seeing them, we will be able to make out what systemic problems also the patient could be facing. So first we'll talk about the anatomy and the physiology of the oral cavity.
Slide. So you can tell them. Tell them.
So our oral cavity, it's the first part of the digestive system, and it consists of hard structures as well as the soft structures. The hard tissues include the teeth and the jaw bones, which is your maxilla and mandible, and the soft tissues include the gums and the lips, the cheek, the hard palate, soft palate, and the tongue, which contains our various taste buds. And now there are two types of teeth, the development of which begins in the second trimester of pregnancy. So first type is the deciduous teeth, which are also called as the primary or temporary teeth. They are about 20 teeth in number and 10 in the maxilla and 10 in the mandible, comprising total of 8 molars, 4 canines and incisors. Incisors are of two types, are central incisors followed by lateral incisors. Then the permanent teeth, they consist of 32 teeth. Okay, and they include 12 molars, which including the third molar, which is also known as the wisdom molar. There are 8 premolars, 4 canines and 8 incisors. So the primary teeth, they start appearing in the mouth by 6 months of age, and all of them erupt by the age of 3. They remain in our oral cavity till the age of 6 years, and then one by one they begin to fall out at their designated time, making the way for the permanent set of teeth. Now, one thing important is that these deciduous teeth are also very important. Like if you see a child patient who is having any problem with the deciduous teeth, that needs to be taken care of. Why? Because the deciduous teeth, they save the place till the time the permanent teeth does not erupt. So it's very important to take care of deciduous teeth. There is a common myth that people believe that the deciduous teeth need not be taken care of because they are going to eventually fall off and permanent set will come. But no, God has given us everything with a reason. So the adult teeth, they grow between the age of 6 to 12 years, and basically a tooth has two parts: the crown part that is visible to all of us in the mouth, and the other part which is embedded in the bone, which is the root. It extends below our gum line. Now each tooth has four parts. First is the enamel, the white portion of the tooth that is visible to you, which is the outermost layer. It's enamel. It's something which is even harder than the bone, okay, and it protects the tooth from decay. It is made up of phosphorus and calcium. Underlying the enamel is the dentine, that is the yellow layer. Though it is calcified, looking similar to bone, but it is not as hard as enamel, and it is at a greater risk for decay if the enamel wears away. Then we have the cementum. The cementum is covering the tooth root, and it also helps it to anchor to the bone. And lastly is the pulp, which is the most important part of the tooth. You can say it's like the brain in the body. So it is found at the center of the tooth, and it contains the blood vessels, nerves, and other soft tissues which deliver all the nutrients and the signals to the teeth. Have you ever felt any sensation to hot and cold in your teeth? So it is because there are these nerve endings in these teeth which transmit this sensation to the brain and uh, give you this kind of sensation.
Yes, as Madam has rightly said, that development of the teeth starts from the pregnancy itself, and the fetus is there. So you have to be very careful when you are giving antenatal advices also, that how important is the nutrition of the mother to be taken care of, so that because it is developing the fetus inside, and if the mother remains healthy, then only healthy baby will be born. Not only the health, but also the oral health of the fetus of the newborn.
It has also been seen
Yes.
that if the mother is not healthy, or if she has repeated infections in her body, then the fetus actually what develops is actually a preterm low birth weight infant. So that becomes an emergency in the hospital care. So as wellness clinics or as PHC clinics, I think it's essential when we do an ANC to diagnose or screen the females who are pregnant, that they do not suffer from chronic diseases or chronic infections, because this results in many problems, and one being associated called as a preterm low birth weight infants.
Yes, very right. So, dear students, you have to be very careful whenever you are looking after. Every stage you have to remember about the oral health of the client who is coming to you. Yes, ma'am. Please continue, ma'am. So, you were talking about the development of the teeth and functions of the teeth. What are the functions of teeth?
So functions are basically chewing, biting. They help also in speaking, and they affect our personality. As Dr. Mehra had already shown you pictures wherein the first look or the first impression is when we see the facial features and the teeth. We miss out the other defects, but it's the teeth which is very important. They add to our personality. And also they help in the growth of our jaw bones and our cranio-maxillofacial skeleton as well. Now, the various functions of the soft tissues around the teeth, they help in mastication, in deglutition, in speech. The salivary glands which are present in our mouth, they secrete saliva into the mouth, and that helps in digestion, swallowing, speech, even in cleansing of oral cavity and protection from various diseases. Our saliva is very important because our mouth is such a dynamic cavity. We are always eating or drinking something, and if saliva is not there, it will not flush out whatever food particles or other things are stuck onto our oral tissues. And even in cases when some patients are having a dry mouth, in them also teeth problems are more in number because this flushing action of the saliva does not take place. So saliva has a very important role to take place in our mouth. And now there are few high risk factors for any dental and oral diseases. First and foremost is tobacco. It could be in any form, smoke or smokeless or snuff, and it is one of the significant risk factors which is involved with development of gum disease and also causing cancer. And also, when a person is a tobacco chewer, there is always a chance that any kind of treatment which is meted out to the patient, it will not be very successful. Then second is a poor oral hygiene. An unhealthy oral cavity will be a source of systemic infections. If we don't keep our oral cavity clean, post our meals or even otherwise, we are bound to be suffering from some infection or disease, oral disease, as it shows. Then unhealthy diet. Unhealthy diet means having excessive fast food or excessive sugary stuff or carbonated drinks. All these are detrimental to our dental and oral tissues. Then in girls and women especially and adolescents, when hormonal changes take place in the body, they makes the gum more sensitive and prone to gingivitis. It has also been seen during pregnancy that women have a lot of gum problem, and that is again because of the hormonal imbalance. So it is not a disease, basically it is something which is associated with the condition that the woman is, that there is a hormonal imbalance in the body, and that is why this is happening. At many times, once the pregnancy period is over, then the gingivitis problem also settles on its own. So these are a few things which you have to keep in mind, what thing is associated with which phase, and whether it is something which is happening physiologically along with the body or it is a pathological process.
Yes, you have also told that sugary food stuffs also causes many, is a risk factor. At the same time, when excessive food, at the same time malnourishment. Malnourishment will also affect the health. Because development will not take place properly. So it is both way. Excess of everything is also bad, and if it is not in proper
Adequate amount, it's
then
again
also
bad.
it is of not bad. So it is very important to emphasize upon the well balanced diet. So yes, but please continue, ma'am. So there is other high risk factors also, as you have told
Like
about
some there are some medications like you have anti-allergics and other medications which actually decrease the flow of saliva in the mouth. And as I told you, the saliva is a very important fluid of the oral cavity. It helps to flush out all the food particles or any other thing which may be stuck onto our tissues and our teeth. So if the saliva production is less, then the mouth is going to be very vulnerable to infections, to gum disease. Some medicines may also cause an abnormal growth of the gum tissue. So this also makes it difficult to keep our teeth and gums clean. There are some anti-epileptic drugs which causes the overgrowth of the gum tissue, and in that case, when the almost the teeth don't even become visible, so it's very difficult to clean that. Then another thing is a genetic susceptibility, that some people will be more prone to a severe gum disease than others. Sometimes it's again a myth, I would say, that people say, oh, my parents had a lot of cavities and that is why I have cavities. Well, it's not like that. I feel that basically it is the eating habits which are also genetically passed on from the parents to the children. What the children see in the house, what their parents are eating, they also sometimes imbibe the same eating habits. So eating a well-balanced and a nourishing diet is more important at the end of the day, rather than having these low-calorie stuff or carbonated drinks or junk and fast food.
Yeah, thank you, ma'am. Dear students, if anybody want to ask any question, please you can ask. In this session, till now we have covered the introduction to oral health, definition of oral health as well as the our health definition. We have covered the functions of various parts of the oral cavity, functions of teeth, development of teeth, as well as the various risk factors which are associated with the oral health issues. So with this we will take 2 minutes break and we will come back to you after 2 minutes. Thank you.
Do you wish to be part of a television studio like this or any other media system? Or already part of any media system, want to enhance a new set of skills? Welcome to School of Journalism New Media Studies. Here in the School of Journalism New Media Studies, we are offering program for all set of people to learn and enhance the media skills. The vision of